my goodness, thank you for clicking on another video of the Daily Dose of NCLEX. Today we are going to talk about peritoneal dialysis. Of course, I'm going to show a question on the screen, and after that I'm going to talk a little bit about peritoneal dialysis, the things that are important for you to know for your NCLEX, and then I'm going to talk about a little bit of nursing care and complications. It's going to be amazing! But before that, listen, if you are looking for NCLEX help and you want to get this ebook for free, a lot of people see this blue book and they tell me, "Hey Mo, what's this blue book?" Listen, I've helped thousands of students pass their NCLEX on their very next attempt, and every student of mine, when they go to the test center after they get out, they actually text me the topics that they got on the real NCLEX. What did I do? Me and my team over the past 12 months, we've been taking screenshots of those text messages and I put them in one ebook, and I want you to have this ebook for free. So there's a link in the description box, so you just click it and you can download this for free, and you can know the exact topics that the students are getting currently on the NCLEX, all right? The real NCLEX world versus NCLEX textbooks. All right, now we're done with that. I'm gonna flip the board and we are going to discuss our question. I'm gonna get the red marker. All right, so you know, if you're one of my students, you know that the NCLEX algorithm is easy. One part of it is that you have to take your time, because time's not your enemy. Only wrong answers, right? So if you have not watched my How the NCLEX is Graded, right, video, then scroll down, scroll up on my YouTube channel, on my Facebook, on my Instagram, and then you can watch that video, and then you would understand why time is not important. Only wrong answers are important. If you know how the NCLEX is graded, now you will take your sweet time. Now, one of the things that I tell my students is that you've got to read the question 3 times. Don't rush it. So that's what we're going to do. This is the question. This is the subject of the question, right? We're not even going to look at the options. So this is the question. We're going to read it. The patient is on peritoneal dialysis. The nurse notices that the outflow looks tinged red. Which action does the nurse take first? All right. The first thing I notice on this question, the second time I'm going to read this question, I'm going to highlight keywords, right? But the first thing I notice is the word first. Right, when it comes to the word first, immediately you've got to know that this is a prioritization question. Yes, prioritization question. So if you're one of my students and you know the 15 NCLEX strategies that you use with NCLEX questions to pass at 75, then you know for prioritization questions there are 2 strategies. There is ABCs, PEEP, right? Of course, this is an algorithm for how you're going to handle prioritization questions, and of course you've got nursing process. All right, nursing process. Now with this question, this is what I tell my students. It's easy to identify which strategy you're going to use with prioritization question. When you've got those questions, when you've got 4 patients and which patient you've got to see first, then it's definitely ABC's PEEP. But if you got a question like this, definitely it's the nursing process. So am I looking to assess the patient? Am I looking for intervention? Am I looking to reevaluate the patient, or whatever the case might be, right? So now we highlighted, we're not going to use this strategy, we're going to use this strategy. Now it's easy for us to critique the options and understand which strategy we're going to use. Now before that, I'm going to read it for the second time and I'm going to highlight keywords, right? The patient is doing peritoneal dialysis. Of course, that's a keyword. That's like an easy keyword because it's obvious, right? Nursing diagnosis or the diagnosis of the patient, if there's signs and symptoms, if there's a drug, that is a definite keyword, right? So the nurse notices that the outflow looks tinged red, right? This is a sign, right? Tinged red. So why the outflow is tinged red? So that's definitely another keyword. Which action does the nurse take first? So first is another keyword. With every question, you need to highlight at least like two or 3 keywords. Don't highlight 10. Now you're doing it wrong. 2 or 3 keywords where you're going to understand what does the examiner want from you, right? Now the third time I'm going to read the question is I'm going to rephrase it. I'm going to close my eyes and I'm going to visualize this patient, right? So this patient probably in a dialysis unit or maybe a medical surgical unit, and you've got he has a peritoneal dialysis. And you see that in the urine bag, the outflow is tinged red. So I'm going to close my eyes, I'm going to visualize the patient, and I'm going to walk myself through this scenario, right? So this is how I rephrase the question. So I walked into the room and I saw a patient who is on peritoneal dialysis, right? The patient, I saw that in the urine catheter there is red tinged outflow or effluent. oh my goodness, what am I going to do first? Now I understand the question because I rephrase it in my own words and it makes sense in my head. What am I going to do first? Because it's tinged red, right? Am I gonna, okay, let's go through the options. Now, option number one, call the doctor. Listen, when you call the doctor, I want you 9 out of 10 times to eliminate this option, right? Now, I'm not saying we're gonna eliminate it in this question, but 9 out of 10 times, the nurse can do something inside the room before she rushes out of the room and calls the doctor, right? So definitely there's something you need to assess on the patient before you run out and, pass the bucket. That's why I tell my students, like, you pass the bucket to the doctor and like, okay, I don't know what to do. Tell me what to do. No, we as nurses have autonomy, right, and critical thinking, and we need to assess the patient before we pass the bucket. Because imagine if you go to the physician and you say, hey, I noticed that the patient has red tinged outflow. What do you want me to do? And then the doctor will say, oh, did you assess the site? And you're like, oh no, I'm gonna go assess the site right now. Dude, you look dumb, right? Okay, so I'm gonna leave this to the end. Most probably it's wrong. 9 out of 10 times it's wrong, right? Number 2, check vital signs. I told you before, right? Checking vital signs, it's always the right answer. Always the right answer. Now in this case, is assessing the vital signs a priority, right? So I'm gonna keep it, but I'm gonna assess if it is a priority or I can do something before assessing vital signs. What would vital signs, show me or indicate, right? So I'm gonna leave it. If it was like tinged red, if it was like bleeding, the patient is bleeding, definitely I'm gonna go assess vital signs right away, all right? Now I'm gonna leave it, I'm gonna read the other options. This finding is normal in peritoneal dialysis. Definitely it's wrong because it's not normal. If you've ever seen a patient with peritoneal dialysis, the outflow will look yellow, maybe dark yellow, but never tinged red, okay? So if tinged red, definitely the patient is bleeding, not bleeding, but definitely if it's like bright red, definitely the patient is bleeding. But there's something going on, man, with blood. So what it is, definitely it's not normal. I'm canceling this option. Ask the patient about her last menstrual cycle, all right? That last menstrual cycle, because it has to do something with blood, will make me think a little bit. And when I present this question on my NCLEX of NCLEX program, the program that my students use to pass their NCLEX on the very next attempt, I get a lot of questions, or my coaches get a lot of questions, where students will say, oh, but the question didn't say if this is a male or a female. How would I know? Come on, man. You think the NCLEX are not gonna trick you into things? They would say, dude, assume this or that. Put the 2 options. So if you assume that the patient is a female and her last menstrual cycle, of course you're gonna ask her, hey, are you during your menstrual cycle, right? Are you having your period right now? So you're gonna ask her that question. And if she said yes, then this makes sense. Right? Then this makes sense. Then this is the right question, and this is not a priority, right? Unless the patient was bleeding. There's no signs of bleeding. There's just tinged red, affluent, or the outflow in the urine bag. So in this case, if the patient is during her period, that is normal because of the hypertonicity of the dialysate. So the dialysate is the bag that you hook to the peritoneal dialysis, right? So let's say this is the patient, and they've got the catheter, so you connect the dialysate to the catheter, and then the outflow, let's say this is the urine bag, which is tinged red, right? So the dialysate, because of the hypertonicity of the dialysate, what happens is the blood is pulled out from the uterus towards the fallopian tube into the affluent, and it will show tinged red. Okay, so that's the right answer. Now let's talk a little bit about peritoneal dialysis. All right, peritoneal dialysis, of course, that is a surgical procedure. So patients have to go to the radiology department and they've got to insert the catheter. Sometimes they call it a tunnel, but the name of the catheter is Tankoff catheter, right? The dialysis catheter, or not dialysis, I'm sorry, but the peritoneal dialysis catheter that is hooked to the patient is called Tankoff. So Tankoff is written like this, Tankoff, right? There's an H here. All right, so what are the things that's amazing about peritoneal dialysis? First, it's a slow process. The patient will be sleeping, or not sleeping, but before they go to sleep, they actually hook the dialysate, and then it takes 8 to 10 hours, all right? So 8 to 10 hours for the cleansing to happen. And then when they wake up, or let's say they sleep for 6 hours or 7 hours, that's enough time. So when they wake up, they disconnect the dialysate and then they go to work or whatever. Sometimes some patients, it depends on the intensity, they actually do the dialysate cleaning or the peritoneal dialysis during work hours. So they go to the bathroom, they hook up the dialysate, there's a hook under their shirt, so they hook it up, connect it to the catheter, and then the process start cleansing, and then they go to work. If let's say they're doing computer work, after 3 or 4 hours, they go back to the bathroom, change the bag, or disconnect the bag, or whatever the case might be. So, but the easiest part and the most common is during sleep. All right. Now it's an easy process. It takes 8 to 10 hours, and then it slowly corrects electrolyte imbalance. Now, if you know, with hemodialysis, the correction of electrolyte imbalance is so quick. So imagine if a patient has a potassium of, for example, like potassium of 6.4, that's an emergency. So you get that patient to a dialysis unit, they hook him up to a hemodialysis, and then within like an hour, hour and a half, boom, that potassium drops to like 4.1 within normal range, all right? Now that does not happen with peritoneal dialysis. It's a slower process of correcting electrolyte imbalance, all right? But because it's done on a daily basis, where hemodialysis is done like 3 times a week, so because of the peritoneal dialysis, it's done on a daily basis, then there's more control on the electrolyte. Now, every patient takes a different dialysate. It depends on their electrolyte, levels, all right? And that is something that the physician orders, and usually they do lab work every week just to make sure that electrolytes are in check. Well, the best thing that I like about peritoneal dialysis is that it's safe. There's no blood involved. The patients won't panic. In hemodialysis, you've got AV fistula that has to be punctured and dressing and all that type of stuff. But with peritoneal dialysis, just a catheter, the patient can do it on their own, and they will see no blood. Now, in this case, we know what's going on. There's no treatment required for red tinged blood here because it will subside on its own when the patient doesn't have her period anymore, all right? Now, the only extra thing that I want to highlight about peritoneal dialysis is that it does not require heparinization, all right? With hemodialysis, a lot of patients think that the patient needs to take heparin and whatever. No, the heparin is in the dialysis machine so that no clots happen, right? But the patient does not take heparin. Now, in peritoneal dialysis, heparin is not required at all. So you just hook the dialysate and you go through the process, all right? Now, when it comes to complications, there's a lot of complications, not a lot, but at least like 2 or 3 complications that happen with peritoneal dialysis. We start with the most obvious during the surgical procedure where they are puncturing the patient and they are inserting that catheter or that tunnel. What happens is perforation might happen to the colon or the bladder. All right, after the insertion and they check everything is fine, that complication does not exist anymore, all right? Now, the second complication is, that insertion site, infection might happen at the insertion site of the tunnel. That's why we need to do proper dressing, and we need to monitor that insertion site frequently, at least once every shift or once every 12 hours. If the patient is taking care of himself at home or herself at home, you gotta tell them that you need to check the insertion site. Dressing is required. Now, depending on the type of dressing, usually every 24 hours, 48 hours, and sometimes 72 hours, even 7 days, some type of dressing with chlorhexidine. Those dressings can stay intact for like 7 days, all right? So you gotta tell the patient that to do the dressing, perform the dressing, or a family member can help, or if they can come to the clinic and perform the dressing, and always write the date, time, and who performed the dressing on the dressing so that the patient does not forget. Now, the last complication with peritoneal dialysis is peritonitis, of course. Now, if the patient is not using a septic technique while they are hooking the dialysate, connecting, disconnecting dialysate, they are not disinfecting, they're not using aseptic techniques with the catheter, what happens? You know, over day 2, 3 days, those, you know, germs, microorganisms starts, what's the word? Mingling into the inside of the body, inside the abdomen, the peritoneum, and peritonitis happen, right? That is so bad. Where the patient has stopped dialysis or peritoneal dialysis, they gotta get on antibiotics. Sometimes they shift them to hemodialysis just during that transition period, depending if their situation is severe or not. All right, that's all you need to know about peritoneal dialysis when it comes to the NCLEX. Listen, don't forget, I'm giving away this ebook for free. All you have to do is click on the link in the description box and get it. It's amazing. Those are the topics that our students got on the real NCLEX, and it's gonna change your life because now you're gonna know what are the exact topics that are currently being asked on NCLEX, all right? Love your face and see you in the next video.
Hi, my name is Amy. I took the NCLEX last week, December 9th, 2021, and I passed. I graduated nursing school in 2016. December, and took the NCLEX for the first time April 2017. After failing the NCLEX, I was absolutely devastated, and I just let a lot of time go by, and I did not have the courage to take that exam again. I'd done a lot of research, and I'd done New World a couple of times, and people told me, you know, just take questions, and I just didn't have the courage to take the exam again. I didn't think I knew enough content, and finding Mo, oh my gosh, I was like, this guy has a lot of energy and I want that energy back again. I used to be so excited about being in nursing school and learning, and gosh, thank God I bought this review. I enjoyed going through the episodes. I learned a lot. It all came back, and I was definitely prepared to take that exam again. I made lots and lots of notes. I reviewed my notes. I bought the test bundle. And I went into that exam, and I did exactly what he said. And thank you, Mo. I know you put up with a lot of my text messages, and you were there for me, and I'll always remember that. And I'm super excited to go into training to be a nurse, and I'm super excited that I'm part of the Alpha Slice family, and I'm going to be on that wall too. And I know you all will if you take this exam, if you take this review and you follow it properly and do what he says, you will pass the exam on your next attempt. Thank you.